Hello everyone, this is Dr. Sakamoto. Today, I'd like to share a case study of regenerative medicine performed on a woman in her 50s with osteoarthritis of the hip. This patient's symptoms started initially in her 30s with hip pain when walking, squatting, and standing up. Here is an X-ray of her hip joint. The left hip joint is significantly deformed and her leg is about 4 centimeters shorter compared to the right. This leg length discrepancy caused lameness, with her body swaying slightly like a penguin when walking. The X-ray findings showed severe deformation, almost in the end stage, and conventional treatment options would likely have been limited to artificial joint replacement. However, this patient learned about regenerative medicine online and came to our clinic. Before administering stem cells, which are the basis of regenerative medicine, we perform PRP, platelet-rich plasma therapy. This is done to significantly enhance the therapeutic effect of stem cell treatment. In this patient's case, we performed 2 sessions of PRP before administering stem cells. A month post-stem cell administration, the patient reported a 20-30% reduction in pain. With each passing month, the pain decreased by another 20-30%. And within about 3 months, the initial pain level of 10 had significantly reduced to 2. Around this time, thanks in part to the patient's diligent efforts in rehabilitation, the lameness, which involved swaying her body, also greatly diminished. Here are the MRI images before treatment and 10 months after. Comparing the before and after MRI images, you can clearly see that the joint space has somewhat widened and cartilage has regenerated to the level that is evident. Pain level of 10 decreased to 2. She wanted more relief, so a second round of stem cell therapy was performed. Approximately 3 months after the second stem cell treatment, the pain was almost completely gone. About 2 years have passed since the initial stem cell administration, and the patient remains pain-free. Many patients with end-stage osteoarthritis of the hip who are suffering from severe and debilitating pain and would normally require artificial joint replacement, in a significant number of cases experience significant pain reduction through stem cell therapy. These patients, who are seeking alternative treatments to avoid surgery, have found that this innovative and less invasive approach can lead to a substantial and noticeable reduction in their pain levels. At our clinic, we provide regenerative medicine with stem cells, along with rehabilitation and muscle strengthening guidance. Today, I explained a real-life case of regenerative medicine for osteoarthritis of the hip. Thank you for watching the video.